Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered language disorder. In this video, we're going to cover speech sound disorder, childhood onset fluency disorder, stuttering, social pragmatic communication disorder, and unspecified communication disorder. There are four disorders that are part of the grouping of communication disorders, which fits into the larger category of neurodevelopmental disorders. The neurodevelopmental disorders can be found on my video page, and they all have orange as the background color. The first communication disorder that we're going to talk about today is speech sound disorder. In order for an individual to be diagnosed with speech sound disorder, they have to have the four following criteria. Number one, the individual has consistent difficulties with producing the sounds of language and because of this struggles to communicate with others. Number two, this lack of ability to communicate creates problems in school, performing a job, communicating with others, or individually psychologically. Number three, these difficulties with producing sound arise early in childhood. And number four, these difficulties producing sound do not come from cerebral palsy, a cleft palate, or any sort of hearing loss or deafness, any type of medical or neurological condition, nor do they come from a brain injury. A child learning language must first be able to recognize the sounds that they're hearing and then use their jaw, tongue, and lips to create those sounds. If a child cannot produce the sounds that an average child their age can make, this is when the child will be analyzed for a variety of neurodevelopmental disorders. Generally, speech sound disorder is not diagnosed until the child reaches the age of 4 years old. This is when most words become recognizable. There are many times when language disorder will be diagnosed right alongside speech sound disorder. This tends to occur in families that have a history of neurodevelopmental disorders.
If a child is struggling to produce the sounds of language because of their jaw, lips, and/or tongue, further problems may be noted. The jaw, lips, and/or the tongue are known as articulators. If a child is having problems because of these facial parts, they may also have trouble blowing their nose, opening and closing their mouth, as well as chewing. Having a physician look at these articulators is beneficial just to make sure that all their body parts are healthy and growing correctly. It is important to have early intervention with a child that is struggling to produce accurate speech sounds. As a child learns words and eventually figures out these words go together, they'll eventually put all the words together into sentences. The more the process is delayed, the longer it will take the child to develop their own language. Language luckily develops in a pattern, and because of this, standardized tests can reflect what is normal for certain age ranges. Children that struggle to produce speech sounds may attempt to shorten words they're having trouble saying. This is because they may know they cannot produce these sounds, and so they'll try to find a way to not say them. It's important that speech sounds are clear and recognizable. By the age of 7 years old, a majority of words should be easily recognized. Generally, children are more likely to have difficulties or miss the sounds for the letters Z, S, R, and L, as well as TH, CH, DCH, and ZH. If a child cannot produce these sounds by the age of 8, they're no longer within a normal range of producing speech. If a child is not meeting grade level expectations, it's important to put a plan into place to have them use and practice these sounds with a professional as well as their caregivers. Majority of children that get speech therapy do quite well with it and don't have symptoms of it given adulthood. If the child has a language disorder, though, it is likely the child may struggle with speech sound disorder into adulthood. Before any child is diagnosed with speech sound disorder, their culture, social environment, and where they grew up needs to be taken into consideration. It is also imperative to know if the child has ever suffered from any sort of hearing impairment or deafness that could have led to this trouble producing sounds. Understanding the child's medical history and whether they've had cerebral palsy, a cleft palate, or other medical or neurological disorders would need to be investigated. The next communication disorder that we're going to discuss is childhood onset fluency disorder, stuttering. In order to be diagnosed with this disorder, the following criteria need to be met. The individual has some sort of disturbance in the flow or timing of their speech, what is not indicative for their age or language skill level. This disturbance does not go away over time and includes one of the following signs or symptoms. Number 1, sound repetition or syllable repetition. Number 2, the sound of a letter lasting too long. Number 3, breaks in the middle of words or pauses within words. Number 4, audible or silent blocking. Number 5, circumlocutions, substituting words to avoid hard to pronounce words. And then 6, words with one syllable are repeated like I. Number 2, this disturbance in the flow or timing of speech can cause great anxiety about speaking, public speaking, or speaking at school or even at a job. These symptoms come about during childhood, and then the disturbance of the speech is not due to a sensory issue, a problem with movement. It was not caused by a stroke, a trauma, or any type of tumor. It cannot be explained by a medical condition or by another mental illness. Before a child is diagnosed with childhood-onset fluency disorder, stuttering, they must be analyzed in regards to others their own age. In most situations, those with the disorder tend to have repetitions of sound or prolonged sounds or syllables, as well as broken words, silent blocking, or inserting other words so they don't have to pronounce the harder word. These disturbances in flow of speech usually will interfere with school or work. Each child is different in how severe the disorder is. Stress and anxiety, though, can make the situation worse for them. If a child feels pressure to communicate, they're going to have a lot more troubles with their speech. Many children will create their own coping mechanisms to deal with that stress and may change the speed of how quickly they're talking or try to avoid certain words during their speech. There are times when an individual has childhood onset fluency disorder and may have like lip tremors or tics, their head may jerk, or they may blink their eyes when they're speaking. So generally about 80 to 90% of cases happen by the age of 6 years old, although some can come about at 7. This disorder can come about slowly or it can come on very quickly. Most incidents tend to come very slowly though, that's more of the pattern. As the disorder becomes worse with an individual, it can become more frequent and will often interfere with many aspects of the child's life. The older a child gets with the disorder, the less they'll want to speak in public. So this is why intervention is really important. About 85% of individuals with the disorder will recover from it. Now, if the disorder is in the family, the risk for other members of the family increase by 3 times compared to the rest of the population. Before a child is diagnosed with child-onset fluency disorder, stuttering, it's important to make sure the child doesn't have a hearing impairment or some type of sensory deficit. The clinician will want to check medications to make sure the disorder is not a side effect of a medication. If stuttering originates during or after adolescence, this is now known as adult onset dysfluency and wouldn't be considered a neurodevelopmental disorder. The third communication disorder that we're going to discuss is called social pragmatic communication disorder. Now, in order to be diagnosed with this disorder, the following criteria need to be observed. Number 1, the individual shows trouble with verbal and nonverbal communications in social situations. So that can mean the individual struggles to communicate in social situations with greetings, sharing relevant information about themselves, or with the environment that's around them. Another one is the individual cannot shift their communication from basically from the needs of the listener. Communication on the ball field may be different from that of the job, and so these individuals might have trouble switching from one environment to another and having communication that fits with each of those environments. They may not understand that people talk differently to children than they do with adults. They may also have trouble taking turns when they talk with others, and talking chronologically through a story tends to be difficult. They may struggle with understanding multiple meanings for words, especially with literature. The individual may struggle with participation because of communication problems, struggles with social situation, and oftentimes this impacts their school and work. The symptoms have to come about within childhood, and then the symptoms are not because of a medical or neurological condition. The big one for this one is to exit out like the autism spectrum disorder. They want to make sure that they don't have that. Another one is intellectual disability, global developmental delay, and or other mental disorders. You want to make sure they don't have those first. Those individuals that are diagnosed with social pragmatic communication disorder tend to have problems understanding the social rules related to verbal and nonverbal communication. They tend to struggle with changing their language for different social environments. They find storytelling to be extremely difficult. They struggle with communicating in public, developing social relationships, being successful in school, and being successful in a job. These troubles with communication do not seem to be present because the child is cognitively slow. The child may tend to show delays in reaching language milestones and understanding aspects of language. The child may try to avoid social situations. They may have behavioral issues. They may have specific learning disorders, and then ADHD tends to be more common with these children. Generally, children should possess an adequate amount of speech by about 4 to 5 years old. Otherwise, they'll probably have a form of social communication disorder. Sometimes milder forms of social pragmatic communication disorder take place in early adolescence when language can become more difficult. Some children do well in time, and others will continue to struggle. This disorder, if persistent into adulthood, can create problems with social relationships and the individual's behavior in social environments. Those children with autism spectrum disorder, specific learning disorder, and communication disorders tend to be at a higher risk for social communication disorder. Autism spectrum disorder tends to be the main reason for social communication disorder. Now, the difference between ASD, which means autism spectrum disorder, and social communication disorder is with ASD, you'll have repetitive behaviors that are part of that. The symptoms of social communication disorder have commonalities with those of social anxiety disorder, but the big difference is the timing when the symptoms appear. With social communication disorder, the symptoms are right away, whereas if you have social anxiety disorder, these can just kind of appear when the person is having trouble with that. Lastly, we're going to talk about unspecified communication disorder. Now, a person may be diagnosed with unspecified communication disorder when they have some symptoms of the disorder, but don't fulfill the full criteria to be diagnosed with the disorder. So, this disorder might also be made when there's not enough information present to diagnose the person with that disorder. Okay, well, we are at the end of our video. I hope you enjoyed it, and if you did, please click that like button and don't forget to subscribe. I really appreciate all of you, and I hope you have an amazing day.